My purpose in public health, para mi gente. I have all these memories of either hanging off the back of my grandma's wheelchair or sitting on her lap as we went all around the hospital, but most frequently arrived at the emergency department to get her care. I saw the numerous people that were so worried and afraid and did not speak the language, let alone understand what was going on around them. It hurt to see people that look like me and look like the people I love so vulnerable and afraid. I wanted to make the health world better for them. I wanted to provide resources in languages they understood that were local and welcoming to them. I wanted them to feel comfort and one day be the person that cared for these people, my people, mi gente. With the experiences of my grandma and the chronic conditions my family had, I wanted to go down the route to become a doctor. That was my goal, and I wanted to become a welcoming face when people are at their most vulnerable. I began to volunteer and became the interpreter for Spanish speakers wherever I was. I saw so many of my people, mi gente, being treated for health conditions that could have been prevented if they had access to the proper resources. I continued volunteering, but when I started college, I learned about health education and prevention. Suddenly it all clicked. There was a way we could prevent their health from deteriorating. I was able to dive into health education by teaching health education classes where I supported participants for prenatal care and helped them find their motivation and harness it to gradually go from walking to their front door to their mailbox and then several times around the block. Through my learnings in health education and prevention, combined with seeing its importance firsthand in preventing chronic disease in my personal life, I realized that even the smallest change can affect not only the individuals, but those that are interconnected to them. Later, as an intern at Strength United, an organization in Los Angeles, I had the opportunity to engage in a youth group and provided resources for middle school students in the San Fernando Valley, the community I grew up in. It was an incredible experience where I was able to support the youth to have conversations with their own community and put together curriculums to help them look at their surroundings through a different lens. I was seeing public health in action, and it cemented my decision to pursue public health to advocate and empower communities and the next generation. I'm now even more passionate about culturally responsive care, ensuring that resources are available and accessible for the vast numbers of cultures we serve. I hope to continue supporting the communities I serve so they can access resources and make healthier lifestyle changes. Not only should healthcare be available to all, but it should be equitable care that considers their language, culture, and needs. I hope to continue to support mi gente, the Spanish-speaking population, to lessen the effects they experience from health disparities. My purpose in public health,